Have you ever wondered what happens to your penis if you don't have sex for a year? A question that may seem odd to some, yet it's a topic that's been the source of many late-night web searches and heated debates. It's no secret that our bodies, including our sexual organs, are complex systems, and their functioning can be influenced by a wide array of factors. There's a lot of misinformation out there, with some people believing that abstaining from sex can cause your penis to shrink or even stop working altogether. Others fear that lack of sexual activity can lead to certain health problems. But how much of this is based on fact, and how much is simply fear-mongering? Are these fears and misconceptions based on scientific evidence, or are they just old wives' tales passed down through generations? Intrigued? Stick around, and let's explore the science behind this fascinating subject. According to Dr. Abraham Morgentaler, a Harvard Medical School urologist, now there's a name that carries weight in the medical community. Dr. Morgentaler is a leading expert in men's health, especially when it comes to the nitty-gritty of male sexual function. He suggests that sexual abstinence can have a significant impact on the penis. This isn't to say that your penis is going to shrivel up and disappear if you decide to take a break from sexual activity. It's more nuanced than that. Consider the penis as a kind of muscle. Just like any other muscle in your body, it needs regular exercise to stay in peak condition. When it doesn't get that exercise, it can lose some of its functionality. Dr. Morgentaler explains that regular erections, whether through sexual activity or nocturnal erections that occur during sleep, help to maintain the health of the penile tissues. Without regular erections, the smooth muscle and other tissues within the penis may change, potentially leading to less firm erections. It's like when you stop going to the gym for a while and your muscles lose some of their strength and tone. Moreover, Dr. Morgentaler points out that regular sexual activity can help keep the prostate gland healthy. The prostate, as you may know, plays a crucial role in male sexual function. It produces a significant portion of the fluid that makes up semen, and regular ejaculation helps to keep it in good working order. But don't panic just yet. The human body is incredibly resilient, and these changes aren't necessarily permanent. If you're abstaining from sexual activity for a period of time, whether by choice or circumstance, it doesn't mean you're doomed to a life of weak erections and prostate problems. So it's clear that abstinence can have some impact. But what exactly happens? Let's delve deeper into the physical changes that can occur when you wave goodbye to your sexual escapades, even if it's just for a little while. When you abstain from sex, several physical changes can occur. Let's delve into some of the most common alterations that might happen. Firstly, the testosterone levels. Contrary to popular belief, abstaining from sex doesn't necessarily mean your testosterone levels will plummet. In fact, one study found that after 3 weeks of abstinence, testosterone levels actually spiked. However, the relationship between abstinence and testosterone levels isn't linear, and the effects may vary from person to person. Moving on to erectile function, it's a common misconception that abstaining from sex can lead to erectile dysfunction. While regular sexual activity can indeed promote healthy blood flow to the penis, lack of sexual activity doesn't directly cause erectile dysfunction. Factors like stress, anxiety, and underlying health conditions play a far greater role in erectile health than abstinence. So what about the old saying, use it or lose it? It's a myth that your penis can shrink or atrophy from lack of use. The penis is a kind of muscle, yes, but it's not the same as the biceps or quads that might shrink without regular exercise. The size of your penis is largely determined by genetics and can't be changed by sexual activity or lack thereof. However, while your penis won't shrink from abstinence, prolonged periods without erections can potentially affect its elasticity. Regular erections, whether they're from sexual activity or nocturnal erections, keep the penile tissue healthy and elastic. Without this, there's a slight risk that it could become less elastic over time, which might affect the quality of erections. It's important to note that these changes aren't a given for everyone who abstains from sex. The human body is a complex system, and everyone responds differently to changes in sexual activity. What's more, these physical changes can be influenced by a multitude of factors, including age, overall health, stress levels, and more. But it's not just about the physical changes. What about the psychological impact? That's a great question, and it's what we'll be discussing in the next segment. So stay tuned as we continue to unravel the effects of sexual abstinence. Sexual abstinence can also have psychological effects. As we delve deeper into this topic, it's important to remember that the mind and body are intricately linked. The absence of sexual activity isn't just a physical experience, it can profoundly affect your mental and emotional well-being as well. Let's talk about mood first. Sex can often work as a natural mood enhancer. It releases endorphins, those feel-good hormones that flood your system after a good workout or a hearty laugh. Without this endorphin boost, some people may notice a decrease in their overall mood, feeling more prone to sadness, irritability, or anxiety. Stress levels can also be impacted by sexual abstinence. Sex is known to be a stress reliever. It's a physical activity that can help distract the mind, release tension, and promote relaxation. When this outlet is removed, stress may start to creep up. It's like a pressure cooker without a release valve. Eventually, the pressure has to go somewhere. Self-esteem is another area that can be affected. For many individuals, sexual activity can contribute to feelings of desirability and confidence. It can be a source of connection and validation. When this aspect of life is absent, some individuals might struggle with feelings of inadequacy or a drop in self-worth. Finally, let's touch on the broader concept of mental health. Sexual activity can be a part of a healthy, balanced lifestyle. It's a form of physical intimacy that can foster emotional connections, enhance communication, and promote overall mental well-being. Without it, some people may experience feelings of loneliness or isolation. However, it's crucial to note that these psychological effects aren't universal. Everyone's experience with sexual abstinence will be different, influenced by a multitude of factors, from personal beliefs and values to physical health and relationship status. It's not a one-size-fits-all situation. So, we've looked at the physical and psychological effects, but what does this all mean for your overall health? Well, stay tuned as we explore this next. The impact of sexual abstinence on overall health can be pretty significant. Now, let's dive right into the overall health impact of sexual abstinence. It's not just about the physical changes or psychological effects we've discussed earlier. The overall health implications are broader and, quite frankly, more profound than you might initially think. For starters, regular sexual activity is known to boost the immune system. It stimulates the production of certain antibodies that help fend off viruses and bacteria. So, if you're abstaining from sex for a prolonged period, you might just find yourself reaching for the tissues more often during flu season. Then there's the cardiovascular aspect. Believe it or not, sexual activity is a fantastic form of exercise. It gets your heart rate up, improves circulation, and can even help maintain healthy blood pressure levels. So if you're not getting busy in the bedroom, you might want to consider upping your cardio game elsewhere to compensate. But it's not all doom and gloom. Sexual abstinence can have its benefits too. For instance, it can allow you to focus on other aspects of your health, like diet, exercise, and mental well-being. Abstinence can also give you the time and space to address any underlying issues that might be affecting your sexual health, like stress, anxiety, or relationship problems. And let's not forget about the importance of maintaining a healthy sexual life for overall well-being. Sex is a natural and healthy part of life. It can boost mood, improve sleep, and even provide a sense of connection and intimacy with your partner. So if you're abstaining from sex, it's crucial to find other ways to fulfill these needs. So, while it's true that your penis won't fall off from lack of use, there are still some important considerations to keep in mind. It's about more than just the physical. It's about overall health, happiness, and well-being. So, whether you're sexually active or not, remember to always prioritize your health. In conclusion, taking a year-long hiatus from sexual activity can indeed have noticeable effects on your physical and mental well-being. We've delved into the medical expert's perspective, explored the potential physical changes, assessed the psychological impact, and evaluated the overall health implications. At the risk of sounding like a broken record, it's important to remember that these potential changes are not set in stone. Every individual is unique, and responses to prolonged sexual abstinence can vary drastically. Some might experience a decrease in libido, while others may find their desire remains unchanged. Mental health can also be impacted in various ways, with some individuals feeling more anxious or depressed, while others may not notice any significant changes. The key takeaway here is that understanding your own body and its responses is essential. If you have any concerns or questions, seeking professional medical advice is always the best course of action. Remember, everyone's sexual health is unique. Always consult with a healthcare professional if you have any concerns. Thanks for tuning in.